The impact is beginning to slow, but what's very telling is these latest figures, and we have to keep something in mind. They are often on a lag, on a delay of at least a day or two, and the figures are not always up to date in terms of being complete. What is consistent, as you said, is who's dying the most after becoming infected with COVID-19.
Coronavirus has spread to every state in the union and certainly just about every neighborhood across our region. But the latest incoming data shows Black and brown patients are dying at a higher rate from COVID-19, the disease caused by the virus, than white patients. The question is, why?
It's unfortunate.
Mayor Andre Saya of Paterson, New Jersey, where a majority of the residents are Black and Latino, says the commonly cited factor of pre-existing medical conditions like diabetes and hypertension in reality often take a back seat to a COVID-19 patient's socioeconomic status.
Geographically, you have high concentration of poverty in certain areas.
Across the Hudson River in New York City,
we have to look in the face these disparities that we're learning about.
Mayor Bill de Blasio was quick to point out long-standing healthcare disparities. But public advocate Jumaane Williams says there's actually another present-day factor, ongoing policy decisions that contribute to the disparities clearly evident in the latest data. It shows Black and Latinos making up 62% of the COVID-19 fatalities, even though both groups represent only 51% of the city's population.
We said that a certain group of people are expendable. The people who came from communities that already had structural inequities.
Looking at the big picture, addressing the why, as in why COVID-19 kills some more than others, still does not get to the how, as in how are we going to reduce and ultimately stop the spread of coronavirus. New Jersey Governor Phil Murphy signed yet another far-reaching executive order stressing, you guessed it, social distancing. The order targets the one place that attracts all of us, regardless of race or tax bracket.
Customers and employees must wear face coverings. Stores must also provide special shopping hours for high-risk individuals, erect physical barriers between customers and cashiers and baggers where practicable.
For Paterson Mayor Andre Saya, who was just diagnosed with COVID-19, that makes sense.
Quite frankly, Jay, I may have contracted the virus at a grocery store because I can't imagine anywhere else I could have.
Mayor Saya says he hopes to be back in the office at work next week, and he's thinking about in Paterson, New Jersey, of placing restrictions on liquor stores. The bottom line, what we've heard from elected officials on both sides of the Hudson River, if the restrictions that are currently in place are not working, there are more coming down the pipe. We are live in East Harlem tonight. Jay Dow, Pix 11 News.